For patients with treatment-resistant depression, the brain's neural pathways associated with mood and anxiety become locked into rigid patterns. At a biological level, these circuits become stuck, leaving them unresponsive to standard interventions. The traditional medical model frequently separates care into isolated silos. A patient might receive medication from one clinician, therapy from a second, and neurostimulation at an entirely different facility. This fragmentation often fails complex cases because a single, isolated intervention rarely has the leverage necessary to disrupt deeply entrenched biological patterns on its own. Disrupting the cycle of severe depression requires a connected ecosystem of care, designed to coordinate multiple biological and psychological interventions simultaneously. The TMS Plus approach intentionally integrates these interventions into a single personalized treatment pathway. This graphic maps out the complete ecosystem. Guided by a multidisciplinary care team, the treatment pathway rests on 4 distinct pillars: precision-guided neuromodulation, personalized immersive therapeutics, data-informed coordinated care, and precision pharmacological interventions. Ketamine Plus operates as the pharmacological layer within this framework, ensuring medication is never delivered as a standalone service. Clinical outcomes depend on nesting these pharmacological interventions inside the broader multidisciplinary treatment pathway. The process begins by targeting glutamate signaling in the brain, which triggers a rapid increase in neuroplasticity. Neuroplasticity refers to the brain's ability to adapt, learn, and form new connections. This heightened state softens rigid cognitive patterns, making emotional processing more flexible. But this window of flexibility is temporary, eventually closing as the brain stabilizes. Long-term recovery relies on the specific therapeutic tools applied while the brain remains in this highly responsive state. Clinicians capture this window by carefully timing treatments, using ketamine either as a primer before other therapies begin or concurrently during active treatment. In Phase 2, MRI-guided TMS actively targets and modulates specific brain circuits while the neural network is flexible. Then, in Phase 4, AI-Personalised immersive therapeutics and behavioral activation programs are layered in to reinforce adaptive emotional patterns while the brain rewires. This forms the synergy hypothesis. Coordinating biological flexibility with targeted magnetic stimulation and psychological reinforcement produces results that exceed any single intervention. Ketamine serves as the chemical catalyst that helps targeted neuromodulation and psychotherapy take hold. Utilizing these powerful biological mechanisms requires a rigorous governance model to ensure patient safety. The K-SET framework is the systematic guardian used to monitor for side effects like dissociation. It tracks symptoms before the dose, at the 60-minute peak, and confirms full resolution by the 120-minute mark. Physical safety is tracked with the same precision, requiring mandatory cardiovascular metrics and orientation checks at specific 15, 30, 60, and 120-minute intervals throughout every session. This acute safety data is aggregated within the MindSkiller digital platform alongside long-term functional outcome measures. This data-informed model establishes the clinical boundary between precision psychiatry and high-volume treatment factories. Because every patient's symptom profile is unique, an interventional psychiatrist tailors a modular treatment package based on exact clinical needs. Integration models like pre-TMS priming or concurrent treatment allow the clinical team to remain flexible and adaptive as the patient responds to care. The goal of this integrated package is to achieve functional improvement and long-term well-being for the patient. Ketamine Plus synchronizes biological interventions, neuromodulation, and coordinated care into a single research-informed pathway for recovery.